All of us who work in healthcare are here to help people, regardless of our position. So why then are some patients developing infections and getting sicker while in the hospital? The sad truth is, many times it's a result of a lack of attention to or inconsistent practices. Infection prevention remains an ongoing challenge. Your facility is focused on reducing the rates of healthcare-associated infections caused by bacteria, fungi, and viruses during the course of receiving medical care, including bloodstream, urinary tract, and surgical site infections. Another problem is multiple drug-resistant organisms, such as methicillin-resistant Staphylococcus aureus. More than 70% of the bacteria that cause HAIs are resistant to at least one of the drugs most commonly used to treat them, contributing to significant patient morbidity and mortality and limiting antimicrobial treatment options. Obviously, no one wants to see patients suffer from infections that can be avoided. It requires keeping infection prevention top of mind and not taking shortcuts, even if you're busy. Good habits will save lives. Every time we interact with a patient or their environment, we risk either transmitting germs or acquiring them ourselves. But this may or may not result in illness. To understand why some people get sick while others do not, we must discuss the chain of infection. Each element in the chain of infection must be present in order for an infection to occur. Infectious agents are disease-causing organisms or pathogens such as bacteria, fungi, viruses, spores, and protozoa. While some of these organisms cause acute or short-term infections, others, such as the bloodborne pathogens that cause HIV, hepatitis B, and hepatitis C virus, create long-term or chronic infections. Infectious agents need reservoirs where they can grow, multiply, and survive. Reservoirs can be individuals who are infected by or are carriers of pathogens, medical equipment or devices that are not properly reprocessed, contaminated water supplies, or food that has been improperly prepared or handled. Portals of exit, such as excretions, secretions, blood, and body fluids, allow these pathogens to leave their reservoir. Pathogens are then transmitted either through the air, by contact with the organisms, or by a vehicle, such as contaminated sharps or healthcare workers' hands. Portals of entry for pathogens may include moist body tissue, non-intact skin, such as wounds or broken skin, the mucous membranes of the eyes, nose, or mouth, and the respiratory, gastrointestinal, and urinary tracts. Individuals who are susceptible to these disease-causing organisms act as hosts. Susceptibility may be due to compromised defenses from underlying medical conditions, being very young or very old, poor nutritional status, undergoing surgery, or the presence of indwelling medical devices such as catheters. So how can we as healthcare workers break this chain of infection? By consistently practicing standard precautions and transmission-based precautions. Standard precautions are the basic infection prevention practices you should use as a minimum in the care of every patient. Standard precautions include adherence to hand hygiene protocols, using the appropriate personal protective equipment, proper cleaning and disinfection practices, taking specific precautions when handling body substances and sharps, adherence to cough etiquette or respiratory hygiene, and following safe injection practices. Hand hygiene compliance is the #1 way to prevent infections because hands are the primary vehicle for disease-causing organisms. Your facility is watching you, and so are your patients, so remember these indications for hand hygiene. Before having direct contact with patients, before donning gloves, before inserting invasive devices that don't require surgery, such as intravascular catheters or urinary catheters, after contact with a patient's intact skin, after contact with non-intact skin, body fluids or excretions, and wound dressings, even if wearing gloves, after coming in contact with the patient's environment, and after removing gloves. Alcohol-based hand rubs should be used in all clinical situations except when hands are visibly soiled or contaminated with blood or body fluids, or after contact with spore-forming organisms such as C. difficile. To apply alcohol-based hand rubs correctly, start with dry hands. Apply the manufacturer's recommended amount of product onto your hand. Rub the solution all over the hands, including the back of hands and between fingers, and continue to rub until hands feel dry. Although the CDC hand hygiene guideline recommends the use of alcohol-based hand rubs over antimicrobial soap for routine clinical situations, antimicrobial soap can be used for any clinical situation and should be used for removing blood or body fluids and harsh chemicals such as cleaning agents. Additionally, plain or antimicrobial soap should be used when hands are visibly soiled, after contact with surfaces that may contain spore-forming organisms such as C. difficile, before eating, and after using the restroom. To wash your hands properly, wet hands with warm water, not hot,